Good afternoon, everyone. You are very welcome to the Engaging Men webinar series, The Win of Men's Health. The panel will be delighted to receive any questions you may have. Please use the Q&A feature located at the bottom of your PC laptop screen. If you are using an iPad, you will find this feature located at the top of your screen. Without further ado, I will now hand you over to Fergal Fox, Head of Stakeholder Engagement and Communications in HSE Health and Wellbeing. Thank you.
Sorry there, Jean, I didn't hear that. Can everybody hear me there? Sorry, Jean, can you hear me? Sorry, I didn't hear that.
Fergal, we have you now. Please bear with us a moment as we seem to be experiencing technical difficulties.
Jean, sorry there now. I'm not sure I can be heard here. We can hear you, that's great, that's all I need to know. Sorry, I couldn't hear you coming in there, Jean. I appreciate the intro, but I didn't hear it. So look, welcome everybody to today's webinar and happy International Men's Day. Apologies for that early hiccup. So look, this is the fourth and final webinar of 2021 on the theme of engaging men, and I'm standing in for Lorcan Brennan today. Unfortunately, Lorcan is sick and we send him our best wishes, and thanks Lorcan for the message this morning. Lorcan has done a stellar job of leading the line on our webinars so far this year, and we hope to have him back in some sort of hot seat in the new year. So my name is Fergal Fox. You might have seen me on here before. I work in HSE Health and Wellbeing on stakeholder engagement and communications, and I also have responsibility for the men's health work, and these webinars are part of our delivery of the Healthy Ireland Men HSE Men's Health Action Plan. That actual action plan is coming to an end this year, but we're looking to develop a new one, and we'll probably be in touch with you about that in the new year. So we've had, as I said, this is the fourth in the series of Engaging Men webinars, and so far this year we've had we started out in April looking at the why of men's health, and we had Biddy O'Neill from the Department of Health. We had Paul Gillen give an excellent presentation. Paul works in HSE Health Promotion and Improvement in the West, and he gives a presentation on Men on the Move. And we had a presentation also from Dr. Noel Richardson on the why of men's health. In Men's Health Week then in June, we had a fantastic presentation from Anne Farrell from the CIE on engaging men in the workplace, and Anne Flannery gave us some insights into engaging men. She works in the Larkin Centre in Dublin, and she gave us some insights on engaging men at community level. And we also had John Egan on board that day from the Construction Industry Federation, who told us about the work that's building up in that organisation to support men's health. We also took part in the Irish Men's Sheds launch webinar during Men's Health Week, and they launched their Sheds for Life impact report. If you haven't seen that, you need to get your hands on it, because it's very interesting and excellent findings in relation to the impact of that wellbeing programme. In September, then we looked at the what, and we gave some more examples of men's health hitting the ground at practical level. Peter Jones gave us a presentation that day on his work in Waterford Local Sports Partnership. We had Janice Morrissey presenting on all the work that the Irish Heart Foundation do to focus on men's health. And we also had Helen Forrestal from the Mary Keating Foundation. She told us about their Stand Up for Your Prostate campaign and the other work that targets men around preventing cancer and their cancer care. So we see it as very fitting that we chose today to focus on the when of men's health. International Men's Day is an opportunity to celebrate men, and I'd like to invite you all to engage with the hashtag Celebrate Men campaign today. This year, the Men's Development Network, who are our partners in delivering this work, is encouraging everyone to hashtag Celebrate Men on social media. So what they're asking is to identify a man whose care and qualities that you wish to celebrate, highlight some of those, and nominate other people to take part. And we have Sean Cooke from the Men's Development Network on our panel today, so he'll tell you a bit more about that. So we have two excellent presentations coming up for you today. We have one on Men's Health Week and one on the On Feirm Ground initiative. And we also have a panel with Dr. Noel Richardson from the National Centre for Men's Health. We have Sean, as I mentioned there, from the Men's Development Network. And we have Francis Bligh from Teagasc. And we'll also have Colin Fowler on that panel, and we'll have a few announcements, and that will be about the height of it. We'll have you off at 1:15, if not before it. And we really appreciate your time and attention for tuning into us today. So first up this morning is the presentation from my colleague Colin Fowler from the Men's Health Forum in Ireland. So who is Colin Fowler and the Men's Health Forum in Ireland? Colin is a professionally qualified youth and community worker with a long history of involvement with men's groups dating back to the early 80s. He has 38 years of post-qualified experience in the statutory, voluntary and community sector. He's worked with young men, support for fathers, acting as a men's work advisor to government departments, and currently he's Director of Operations at the Men's Health Forum of Ireland. The Men's Health Forum of Ireland is a diverse, volunteer-led network of individuals and organisations, men and women, which seeks to promote all aspects of health and wellbeing of men and boys on the island of Ireland through research, training, networking, practical health initiatives and awareness raising. And celebration of Men's Health Week is a core part of their work. Colin has been leading the line on Men's Health Week, then really on an all-Ireland basis for many years, and been a key partner and ally for us. And we've all benefited, those of us that are working in the area of men's health, have benefited from a steady hand and hard work. So Colin will be presenting, but first of all, we'll show you a short video about Men's Health Week.
This has been another exceptional year. The island of Ireland continues to wrestle with the COVID-19 pandemic. Individuals are trying to rebuild their lives, relationships, jobs, finances, health, networks and routines. During this difficult time, we have become physically disconnected. Everyone's mental health has also been impacted to some degree. We now need to focus upon re-establishing our relationships with family, friends, our communities, support systems and health services. Men's Health Week offers an ideal time to start remaking these connections and to check in with yourself to see how you're coping and feeling, check up on those around you to see how they're doing and to offer support, and check it out if you notice anything that's worrying or which needs medical attention. Will you join us?
Good morning, everyone. How you doing? My name's Colin Fowler from the Men's Health Forum in Ireland, and I'm just going to give you a wee quick overview of Men's Health Week on the island of Ireland every year. Maybe start by just giving you a few sort of background notes on Men's Health Week and what it is. Firstly, the Men's Health Forum. The Men's Health Forum itself began in 1999, so we were 21 last year, and we work on an all-island basis to enhance the health of men and boys. Primarily, we're a volunteer-led network of individuals and organisations, men and women, and we focus upon awareness raising, research, training, modelling pilot projects and networking. And as the only paid worker, we have to rely very heavily upon goodwill, innovation, creativity and partnership to meet our goals. So as Fergal had said, Men's Health Week is a very central part of what we do each year, and the work that we do in the Republic of Ireland is funded by HSE Health and Wellbeing. Now, I'm not a particularly great betting man, but I can guarantee almost one thing for sure. If I was to walk out today onto the streets of Dublin or Cork or Limerick or Galway or Belfast or anywhere in the island of Ireland, and I was to stop people and say, what is a men's issue? A lot of people would probably have a strange look on their face. They'd be a wee bit bewildered. They wouldn't really know what to say, and they probably couldn't give me much by way of an answer. But if I asked the same people what the women's issue is, they probably would be able to answer that question. And so we start the journey talking about Men's Health Week with this concept of an invisible man. H.G. Wells had written a book, of course, about that. But in the island of Ireland, despite the fact that we were the first country in the world to have a national men's health policy, men, to some extent, remain slightly invisible. As Fergal had said, Engaging Men webinars have now focused upon why and how and what of men's health. And today's one looks at the when. And I suppose the when tends to be the bit that gets sidelined often when we start to think about how we engage with men. But at its most basic level, it's probably a crucial question because, for example, a lot of men today are still in full-time employment and see their role of worker as being crucial to who they are and what they are. So when we do something is obviously going to be impacted by their availability. Of course, the shift work. So even boys who might work during the day who are free at night might not be the same for every man across the island. And of course, men, like women, have other interests and hobbies and caring responsibilities as well. Now, when we think of the when, there's obvious things that we know we should be watching out for. It's likely, of course, that some men might want to watch the World Cup or go to the National Ploughing Championships or be there for the All-Ireland finals or the lead up to the matches. But then, of course, there's also local traditions and local patterns of how and where men go and when in their local communities. But I suppose for today, International Men's Day, it's also useful to think about how we find the high-level things to tag onto this, so as that the when for men can relate to bigger things, national things and international things, like International Men's Day or World Mental Health Day or World Suicide Prevention Day, or in our case, Men's Health Week. And I suppose that's a really important thing, because for a lot of men, it gives us a focus for collective action. It gives us a sense of common purpose. And I suppose more importantly, it makes us feel that we're doing something which is mainstream. We're not on the edge. It's not a fringe activity. So today, as we said, is International Men's Day. And this, of course, is a really important day, a very important when, if you like, to hang our hat on all things men. However, when we think of the when, there's also banana skins to look out for, because as some of you might already know, not only is the 19th of November International Men's Day, but it's also United Nations World Toilet Day as well. And so when thinking of a when we plan and do things for men, we have to be very careful not to give out some mixed messages. So anyhow, what is this Men's Health Week that we've talked about? Well, firstly, I suppose Men's Health Week happens to a formula every year. The formula is quite simple. It begins on the Monday before Father's Day and ends on Father's Day itself. And Father's Day is always the third Sunday in June. So that's how you know about it. It's celebrated across many European countries and a lot of the English-speaking world. And I suppose we have our roots not in Ireland or even Europe, but in America, when in 1994, President Clinton signed into law a bill in Congress for a Men's Health Month. But it wasn't until the early 2000s at a Congress in Vienna that some countries got together and decided that we should try to have an International Men's Health Week. And from that time on, we have marked it in Ireland. In 2005, however, was a big important point for ourselves, because we took on to try and do some all-island coordination of the week. And from those very humble beginnings, we now have more than 95 active partners who help us to plan the week every year. So the aims are quite simple: to heighten awareness of preventable health problems, to support men and boys to engage in healthier lifestyle activities and choices, and to encourage the early treatment and detection of difficulties in men. But round about 2011, we had a change of direction, because up until that point, the theme for Men's Health Week each year focused on a medical condition. It focused on things such as chronic illness, or obesity, or physical activity, or mental health. And in the aftermath of the recession in Ireland in 2011, we decided that we should move towards a broader theme, things which reflected social determinants of health as well as medical conditions. And one of the beauties of that, of course, was that it was able to attract a much wider pool of collaborators, because everyone could see that they had something to offer and there was something for them in it as well. And so we set about trying to have this new form of Men's Health Week in Ireland. But there was a few problems for us. We all had to face in the same direction, and we had to spend a lot of time looking at how, what, where, who we were, and what we wished to achieve. And so the first thing we had to do was come up with our value base. And we opted for a very strengths-based approach to Men's Health Week, not seeing men as a problem to be fixed. We also then looked at the one size fits all, because often what we try to do is find one program that will suit and fit the needs of all men. But we also had another problem in that sometimes we overcomplicate things. And what we realized that actually working with men is not rocket science. To a big extent, it's common sense. And I know, of course, common sense isn't sometimes that common, but we realized that if we use some common sense and applied it, it would do the trick for us. But another big thing for us was the idea of experts, because often we wanted someone to come and fix the situation for us, someone to tell us what to do. And what we realized really early on is that we were the experts. The 95 or more groups that meet together, that we have the expertise within our own group and our own body. And I suppose we also had to acknowledge that there's not one simple way to do things. There are only some people who know some things, some of which work in some situations, sometimes. And so in a way, we all become the pioneers on the journey of improving men's health. But at the end of this, I suppose it was a model of how or what way we should approach it. And this diagram sums it up for me. On the one hand, there's the apathetic people, the people who say men aren't interested in their own health. Men wouldn't come along to programs if we offered them. And what we do is we turn our back on them. And then at the center of the circles, there's the people who have sympathy, but maybe they have too much sympathy. And in so doing, they actually end up in the quagmire, the same bad situation that a lot of men are in themselves because they jump in to help them. And what we realized that for Men's Health Week to work, we had to look through the eyes of men. We had to be the middle circle, the empathetic circle, that we would see what the world of men looked like, and based on that, try to offer things that would appeal to them and would bring them along with us. So for 2021, we decided that Men's Health Week, every year has a theme, as I said, but for 2021, the theme would be making the connections. You saw the animation at the start with the call to action of check in, check up, and check it out. And deliberately, this was a broad theme. We were coming out of COVID. People really were struggling a wee bit with those connections and had lost their sense of relationships with other people. But again, like every other year, it was very partnership driven. And so what do we offer? And the important thing to say is that every year for Men's Health Week, we offer all of these things for free. Other groups in other parts of the world use Men's Health Week as a fundraiser, but we have always taken the position that we should give things to people for free because there's enough difficulties facing men, there's enough barriers and challenges to engagement without putting money as one to add to that list. And so those are some of the things you can see on screen. We produce a web page, an information portal for people to find out what's happening. Video materials, audio materials, animations, the things that people need on the ground, the posters, the postcards, the logos, the badges, the banners to give out. The social media is obviously very, very important in this day and age. And at the local level, advice and support for local groups planning activities, signposting them to resources, giving them the evidence base for why they should do it and a toolbox for action. And one of our most successful things every year, our man manual, our challenges and choices man manual. Last year, we gave out over 20,000 hard copies of that as well as the soft copies. And of course, we need people to front it up, ambassadors, champions, and we need to get those people into the press. And this is what it looks like in practice. Men's Health Week in a nutshell. However, the one thing we learned about Men's Health Week, particularly during the COVID years, is that we really have to do our best. We just have to take the bull by the horns and try to do something. And I suppose our one lesson or one key piece of advice was don't stop doing all the things that you can do because you're worried about all the things that you can't. And certainly in the COVID years, we had a stop-start policy. We weren't really sure how to progress, but we kept the faith and we got on with it and did it. And so I'd just like to finish with just one last wee thought for you. It's a very, very sort of interesting and quite cute quote from a children's attitude survey in America, when a group of children were asked, why and what should you do on a date? So what should you do on a date? And an 8-year-old girl replied, dates are for having fun. People should use them to get to know each other better because even boys have something important to say if you listen to them for long enough. Thank you very much.
Thank you very much, Colin. That was a lovely quote to finish on there. And we might come back to discussing that in more detail in the panel. The next presentation we have is from Conor Hammersley. And this is, Conor is a PhD scholar working with Teagasc and the National Centre for Men's Health in IT Carlow. Rural health and wellbeing is Conor's area of speciality with a particular focus on farmer health. His PhD is part of a wider project entitled On Feirm Ground, which aims to develop a national farmers' health training programme to equip frontline agricultural advisors with the knowledge, skills and competencies to engage and signpost farmers on health issues. So we'll be learning a bit more about that in Colin's presentation. Colin's work has been explicitly focused on delivering impact-focused research activity that forges strong links between research and practice. So Colin will be given us a presentation, or Conor will be given us a presentation now. But first of all, we're going to look at a video, Martin's story, which gives us a real insight into, the background and the rationale for focusing on farmers' men's health.
I remember as a young fella hanging around here, all the neighbours would be here and that. It was fantastic. The whole community would be down there in the back field, and I remember myself there between the divider and the thresher, working away there, and the fella would show me how to use the fork and how to build the haycock, how to shape it and how to finish it. But you know what? I often wonder nowadays, who's going to pass those skills on now? Those skills are gone now. Those congregations and people coming together, that sense of community is kind of gone now. Rural Ireland has changed an awful lot. Very isolating here now. Even though I have a busy road there, I see cars passing up and down there every day of the week, but there's no one to talk to. It's fierce isolating. I said, well, I am kind of lucky. Every so often, every month or two, I get to go to the mart and I see the lads and I stand there and we chat and we talk and we look at the animals. But I think about the tillage farmers in another part of the country. He'd have nowhere to go to. The other thing about the west of Ireland, the holdings are very small. They're very, very small here like that or whatever, and we're dealing with mad Atlantic fronts coming in on top of us all the time and dumping rain on top of us day in, day out. But you know what, I love farming, I kind of love the way of life, but I often wonder there's hardly enough in it like that to keep a family going nowadays, particularly in the west of Ireland. Sometimes I see farmers, they have to run fast to stand still. I mean, my brother-in-law down in Tipperary, who's good to me now, I have to say, with the father, but he was farming with 100 cows there 7 years ago. He's 250 cows now, 7 years later. Just pressure now doing farming. I feel pressure like that you have to get bigger. You're going into the bank, you're borrowing more money, and again you're lying awake at night. I'll tell you, if it's not the cattle you're worried about paying back the mortgage, the money on the land. You're worrying about dealing with solicitors, dealing with accountants. You're dealing with health and safety men coming around. Sure, I've had no school in that stuff at all. I didn't be talking to me and I was just hoping to have me interest at heart. You're trusting those people. And by God, if I have a calf born or whatever, I have to log it. And that's not easy. If I want to fix a roof on my own shed or whatever, by God, I have to go and those alterations have to be passed by a higher power. You're lying awake at night. And then a couple of years ago we had cryptosporidium, so we couldn't even drink water in the house, and you wonder you can't even give it no drink to the cows. That's all pressure, and as a farmer, that's what it's all about. You have the pressure to keep it going, to honour the people who went before you, to do it right, to stay with it. And I wonder about going forward. I wonder if there's a plan going forward for the young fellas. Will they stick with it or whatever? Because I remember growing up or whatever, I always helped my dad after school, and I'd come home and I'd spend a few hours with him, and I'd help him at the weekend because he needed it. Would you give me a hand there, Jack? And of course I did, but you know what? I was 40 years giving him a hand. And I got no salary really. He throw me a few bob or whatever. Just for who'd marry into that kind of a situation? Dad passed on, God rest him, and there was no talk of succession or anything before or here nor there or whatever, but he gave me the land anyway. I don't know if it's a blessing or a curse. But you know what, I like it and I'm here with it, and she's putting up with me and we're here together, but it gets in on you too, and it's getting in on me. And I'll tell you, it's unhealthy. It's not good for you. Because you want to be able to talk. I mean, you hear about talking, you hear about counsellors and being able to share your troubles and troubles halved and all that kind of stuff. It's right, but by God, I haven't done it, and I probably need to do it. Because this is a small area around here, and people will be talking about you going in to see that fella going up the stairs there, and what's he going in there for, or whatever. But I need to pluck up the courage, because I can't keep going the way I'm going or whatever. Sometimes I go in there and I'm tired and I'm irritable, and she gets it. That's not right, she getting it. She shouldn't be getting it at all. I should be having it off my shoulders and be able to talk it out. Go into the doctor, tell him about it, and maybe he can direct me where to go or whatever. There's support lines for this and support lines for that. I just need to pick up the phone. There are good people out there who I know are willing to help me. But it's people like me who've grown up without any help and who've shown no sign of weakness or any bit of vulnerability because we were told not to. So I'm afraid to do it, but do you know what? I may have to.
So thanks very much for that introduction, Fergal, prior to the video. I suppose just to reflect on Martin's story, who's the character in that video, prior to I get into the On Feirm Ground work. And I suppose while that was an actor, the content that was relayed within that clip was actually content that was relayed to us when we collected data for this On Feirm Ground project from farmers up and down the country throughout Ireland. So, you know, it just kind of demonstrates the lived experience for many farmers and kind of the challenging stories that many farmers face throughout Ireland, you know, in relation to their health. And I'd kind of touch on that and where the On Feirm Ground program kind of fits into that throughout this presentation. So I suppose, as Fergal said, my name is Conor Hammersley, and I work in the research side of the On Feirm Ground program. I come from a rural family in South Tipperary, in a little village called Clonolty, and my professional background is in health promotion and social science. But I suppose my understanding of farmers and rural communities is rooted in my lived experience in those communities and seeing firsthand, I suppose, the very positive aspects of rural communities and the supportive and communal aspects of them areas. And I often feel bad even, you know, by addressing farmers by their occupation, because they're so much more than their occupation. You know, they are family members and they're community members. They're part of our sports clubs, our GAA clubs, our tidy towns, you know, and other rural organizations. But unfortunately, you know, many farmers struggle with their health and struggle to present with some of the health challenges that they face. And essentially, the On Feirm Ground program is to try and engage with farmers more in relation to their health by training up agricultural advisors who, you know, would meet farmers on a regular basis, you know, in relation to more agricultural matters. But what we're looking to do is train them up to equip them with the skills to be able to relate to farmers in relation to their health and open the conversation with health and encourage them to be more proactive with their health. And if appropriate, you know, signpost them to local health services in their area. So that's the broad kind of overview of the On Feirm Ground project. But a very interesting aspect of the On Feirm project is the unique partnership model that it has, and that's supported by both the Department of Health and the Department of Agriculture. You know, and I think bringing policymakers together with researchers, with farmers, and with other support-giving stakeholders to understand what are the key lessons that can be learned in relation to gaps of provision for farmers' health. And ultimately, how can we support farmers' health, you know, more robustly in Ireland, with particular considerations for the unique challenges that farmers face in Ireland. So we have a unique partnership model that is made up by the National Centre for Men's Health in IT Carlow, the HSE, Teagasc, the Engage Men's Development Network, training team, and Waterford Institute of Technology. And the project coordinators on this program is the Men's Development Network. So it's been a very interesting task trying to get this project off the ground. The lads warned me beforehand not to talk about any of the arguments that we've had. So I would not only joke. We get on very, very well. And it's just great that the On Feirm Ground project is actually up and running at the moment. And we're now training agricultural advisors in this space to equip them with the skills to engage with farmers and signpost farmers in relation to their health. So I suppose the next question is the why of it and why the unique partnership. And just to give a bit more context in relation to the health outcomes and the risk factors that farmers face in Ireland. So in relation to health outcomes first, so farmers in Ireland demonstrate some of the highest levels of adverse health outcomes, you know, relative to other occupations in Ireland, with particular concerns for heart disease, cancers, and mental health. And the author of a significant study that highlighted this in 2013, Bligh Smith, stated that farmers are 7 times more likely to die from any cause death than the next lowest risk group. And then just in relation to some of the more cultural aspects that farmers face, and the cultural aspect is quite a significant one, and I will develop this a bit more later in my presentation through our own findings. But some findings to date suggest that rural men report lower rates of stress and depression, but much higher rates of suicide. So that would suggest that there's a massive gap in help-seeking behaviour among farmers and rural men more broadly. And in general, hold more stigmatised views towards help-seeking and mental health. And just then in relation to geographically and the socio-geographical nature of farming. So farmers have been identified as a hard-to-reach group in relation to their health. And there's also this sense of loneliness reported among farmers, with Alexis O'Reilly noting that farmers are less likely to have an intimate social relationship than non-farmers. And then, as Martin alluded to, there's many unique occupational stressors that are often external variables that are outside of the farmer's control in relation to weather and price fluctuations, and also agricultural change that's very prevalent at the moment in the context of climate change, which is ultimately reshaping farming practices, with much more restrictive regulation in farming. And also added to this is the stigma that can surround farmers in relation to the environment, and the perception amongst certain cohorts, of farmers maybe being polluters is a significant cause of concern for many farmers. It can often kind of maybe polarize farmers from other sectors within society. So essentially there's this kind of complex web at play that compromises farmers' health and well-being and help-seeking behaviour in particular. And ultimately the On Feirm Ground programme, which is not an answer to all the challenges that farmers face in relation to their health, but to try and make a more resilient farmer who is capable and feels comfortable in reaching out for support when their health is compromised. So we've done a nice bit of work to date, and we've had, I suppose, 4 significant outputs. And the first one mentioned here, the On Feirm Ground programme, that was basically an amalgamation of the 3 that are mentioned below here, that formed the design or informed the design of the training programme that's currently being carried out for agricultural advisors. So we ran focus groups, from October 2019 to just before lockdown in March 2020, that explored different challenges that farmers face in relation to their health and how they relate to health, but also explored that the role agricultural advisors might be able to play in reducing some of the barriers that farmers face in relation to their health. So the first study that we got published recently in the American Journal of Men's Health looked at masculinity and identity, and those being significant barriers for farmers in relation to how they engage with health. And the second one then was in relation to the role that the advisor, the agricultural advisor, might be able to play in engaging farmers a bit more in their health. And the last paper then that we have in construction at the moment is the changing nature of agriculture and how this is having implications for farmers' well-being. And when we collected all this data, we conducted focus groups and interviews with farmers, but also wives and family members of farmers and farming representative organizations as well. So just in relation to just a snapshot of our findings. So in relation to our first key theme that I mentioned there in relation to identities and masculinities, and just to give this a bit more context in relation to sex and gender and how this plays out. So with an individual, sex being their biological makeup that makes them male or female, and gender is the cultural construction of performing man or woman. And this is something that was very evident among farmers, so the social pressure on many male farmers to demonstrate themselves as tough men. So we note that farmers' emphasis on autonomy, stoicism, and self-reliance associated with the construction of farming masculinities can fuel negative attitudes towards health, emotional expression, and help seeking. With one farmer in particular in the west of Ireland saying, looking for help is like admitting you're a failure. It's not in our genes to talk about things. And this was shaped in practice by working long hours, being committed to hard physical labor, being stoic, self-sufficient, and strong in the face of adversity. And it was rooted in farmers, patrilineal connection to the land, with another farmer saying that you always feel you have to be working. My farmer always worked, He didn't take weekends off. It was just a farm. You feel that responsibility. And to some extent, the burden of it. And that's not to suggest that farmers don't need to be resilient in the work that they do. They do need to be resilient for a lot of the work that they do. But, what we're trying to do is trying to, hold on to that good nature of masculinity, but then also encourage them and support them and make them feel comfortable to open up and confront some health challenges that they face. So the second theme that I mentioned earlier was in relation to identity, well-being, and changes at a policy level having consequences for farming practices, with much more regulation in farming and farming becoming much more technically challenging. And it was felt that this was leaving many farmers behind, with one farmer in particular saying that all this is making life more difficult. They want us to look after the environment along with all the other jobs. I love farming, but my farming isn't valued anymore. Nobody cares about us. Before you could make a good living of having cattle, but not anymore. And this is just a little text from the literature in relation to how changes in agricultural governance and at a policy level can have impacts in relation to farmers' sense of self. So failure to meet ideals can be particularly damaging for men's identity and mental health, with certain manifestations in relation to depression and other mental illnesses. But if you look down here, Bartlett and Conger 2004 study noted that there are many examples of mental health issues or even suicide as a result of farmers failing to meet expectations of maintaining viability. So we would note that, when change is going on at a governance level, it needs to take into account the ripple effects for farmers' identity and well-being. So finally, just in relation to the advisor's role and how they would maybe taken on this kind of an extra layer to the work that they're already doing in relation to promoting health among farmers. So there was a strong feeling towards assuming a type of health connector role, and more importantly, towards the need of basic training to engage with farmers more appropriately. And all the focus groups that we did conduct with agricultural advisors, they were all very receptive to this type of role and acknowledged kind of the necessity of there being someone there to encourage farmers and to signpost farmers in relation to their health. With one advisor in particular saying that if we're trying to help with the welfare of the farm, looking after the welfare of the farmer needs to be central to that. But then also another significant thing was that while many agricultural advisors who would meet farmers on a regular basis, they were coming across kind of distress and mental distress and emotional distress with farmers, they felt ill-equipped in their capacity, to be able to deal with this stress. With one advisor in particular saying that even if we just had the basic skills, just knowing how to open the conversation safely with someone and to offer them some guidance or refer them to someone else. So that was it. Essentially they knew the importance of it, but then they felt, it challenging to kind of engage with farmers on these more intimate and sensitive matters. So finally, just to conclude, and some lessons that we've learned so far. So the stoicism, so typical of normative rural masculinity, prevents men from seeking help when their health is severely compromised, particularly around mental health. And I suppose stigmas are rooted in silence, and if something isn't spoken about, a stigma will occupy that space. So essentially, the stigma around emotional health for farmers is a cultural construct, and anything that is culturally constructed can also be culturally deconstructed. And I suppose that is the essence of the On Feirm Ground program, that we're kind of trying to deconstruct some of these cultural normative behaviors that, men and farmers in particular feel that they can't present with some of the health challenges that they face. And we know that to improve health outcomes among farmers, attention must not only focus on health impacts, but also challenge normative rural masculine behavior, and that associated behavior of what many perceive to be manly needs to be contested and exposed as a construct that is inherently unhealthy. So we also know that a key aspect of engaging with farmers on health is on creating this safe space and empathizing with the world of farmers. And this is a core element of the rollout of the On Feirm Ground training. Advisors, we know too, and they know it, are strategically positioned to support farmers in relation to their health and encourage and signpost them. So that's basically it from ourselves. And at the moment, the On Feirm Ground training is being rolled out and it's been received very well by advisors and the trainers who are rolling it out. So So all is going well so far. And, hopefully we have another evaluation going on in 6 months' time with farmers and with advisors. So hopefully we'll be able to kind of capture a more nuanced approach to how On Feirm Ground is going. So thank you very much. Someone told me before, a presentation isn't complete if you don't have a quote from a dead philosopher. So here's my quote from a dead philosopher to finish up. And thank you very much. And I'll hand you back to Fergal.
Thank you very much, Conor. That was really interesting. I like the way that you outlined, you seem to outline very simply what the issues around stigma that we're struggling with there in relation to the health and wellbeing issues for farmers' health and the way they engage or don't engage enough. So it's really inspiring to see the path that we're going on there and trying to link with the agricultural advisors. And we learn a bit more about it now in the panel. So I'd like to introduce the panel up on stage at the moment. So we have Dr. Noel Richardson, Director of the National Centre for Men's Health in IT Carlow. We have Sean Cooke, CEO of Men's Development Network. And we have Francis Bligh, Health and Safety Specialist in Teagasc. And we welcome back Colin Fowler, Director of the Men's Health Forum in Ireland. Have we got everybody there? We do. Okay, great. Thanks, guys, for coming back in. So it's International Men's Day. Just to flag, before we finish this chat, we might ask you all, who would you like to commend on a day like this in light of the campaign that the Men's Development Network are running to celebrate men? But first of all, like in my introduction earlier, I was saying, we've had 4 webinars this year. This is the 4th, but we started this day last year, really, because we said we'd do a webinar on, the impact of COVID on men. And men's mental health. So that's what we had a very engaging webinar last year. We had a focus, and we had a video from a farmer. We had some young men that the Spun Out organization helped us pull together. And we also had Shedder, and I think we had a presentation of the day with Aisling McGrath on the work of the Sheds for Life at that point. So just to ask you an open question, we're still in COVID. So the impact of men and how we need to respond to support men and boys. Anybody want to come in on that for a start? Noel, maybe I start with you there.
Thanks, Fergal. Yeah, it's a really good opener. I think in terms of the ebb and flow of the pandemic, that's where I'd start. This time last year, I think we felt we had things under control. The numbers were low, and then we all know what happened over Christmas and into the new year. And this year, we're faced with a lot of uncertainty again now, because after the rollout of the vaccine, we all felt we'd be home and dry. But there's a sense that there's a lot of uncertainty about it. So I think that's the first learning, really. I think as men, we're taught from a very early age that to be in control, and Conor talked a lot about this in his presentation, is really a key indicator of masculinity and of being a man. But I think what the pandemic has taught us is that very often we actually don't have control. And I speak in a personal capacity as well, having been diagnosed with Parkinson's 10 years ago. Prior to that, I felt I had everything kind of under control and wrapped up. And of course, that's never the case. So I think that there's also a freedom in acknowledging that you don't have control over everything. I think that's a key message for men in particular, that not being in control isn't necessarily a sign of weakness or not being a man in some way. So the pandemic, I think, has taught us that. The second thing I think that's worth reminding ourselves of, and the webinar last year highlighted this, is that not all people are impacted similarly from the pandemic. And we know that for men from, say, social disadvantaged backgrounds, men with higher incidence of underlying conditions, they are disproportionately impacted by the pandemic. So it's really important that our ongoing efforts in terms of policy and program provision and so on, that we target those men most in need. And the last point I'd make is that, on a really positive note, the pandemic, I think, brought out the best in a lot of us. If we look at the work of frontline providers, if we look at all the volunteering work that went on around and across the country, it really indicated a kind of restoration of that sense of community and that sense of mehel that Conor alluded to as well in his presentation. And I think very often we assume that the beneficiaries of those good deeds are the recipients of the good deeds, but there's a real gift in giving of your time to others as well. And I think that's a key lesson we should bring with us, and to maybe jump off the rat race we often find ourselves in, and to kind of think about what really matters in terms of being community members and contributing to community.
Yeah, that's a very good point. Anybody else want to come in on that? I appreciate that, Noel.
I could add to maybe another positive reflection on it as well. I think, and certainly Conor talked about it in terms of identity and masculinity and the roles of what it is to be a man in society today. And I think COVID allowed men to reflect on their role within their family, within their own communities over that period of time. And certainly from the start, I think there would have been a significant rise in uptake in terms of men taking on the specific unpaid caring roles within the family, doing homework, doing the walking around, being the emotional support within the space. It was really quite a significant upsurge in that. And I think a lot of men, when things started maybe open up again, began to think a bit differently about stepping back into the workplace in the way that they had before, where they were extremely kind of focused on work and leaving the kind of the more caring, emotional support roles to their partners rather than actually taking them on themselves. So that was a very, very positive thing that happened as well. And it's always good to take out some positives out of COVID, because I think certainly the uncertainty that we're in now is a real heartbreak for a lot of people, myself included. I think you just don't know whether you're coming or going in relation to it. And that kind of uncertainty creates a huge amount of anxiety. And I think that's one of the critical kind of outcomes that I've seen, in that among men and everybody generally, like the levels of anxiety that are moving throughout communities and individuals themselves are quite significant, and we need to be mindful of that and allow people to transition back into work as well. If they're coming back into the work scene, that they can do it safely and without worry and without constraint as well. So
isn't it so important just to acknowledge, like, you know, you're literally acknowledging things there. We don't have control, as Noel said, but to acknowledge that, you know, everything isn't going to be perfect for a while, you know what I mean? So Francis, I saw you nodding there on some of what Sean said. Do you want to come in across that?
Yeah, well, I suppose I'd just add to what Sean said and what Noel said, you know, that sense of doing our best, you know, being aware of I suppose the challenges that everyone is facing and trying to do our best for each other. You know, it is bringing people into different roles that they wouldn't have maybe experienced at the same level before. And by doing so, then you're more aware of what each person is dealing with. And I suppose for ourselves in Teagasc, we're very aware, I suppose, of the isolation issue that's there. And as Sean said, that anxiety and fear that's out there. I suppose we're focused obviously on the farming community. And I know that our advisors are doing things in different ways. There's more use of the phone now than there ever was. You know, they're making more and more phone calls, making sure that contact is maintained. Just that phone call can make a big difference for people. So just to keep that up and keep it going. And, you know, we are in I suppose things are getting a little bit uncertain at the moment again. So like we have to keep the focus and keep the pressure on and make sure we don't just let it fade away, that the initiatives that we started off maybe last year, that they continue with gusto.
Okay, thanks, Francis. Colin?
Yeah, I would agree with everything that everyone said. As Noel had pointed out, you know, not only are men disproportionately affected by COVID in terms of the complications, the development and the death rate, but within different groups of men, that's very, very marked as well. But as Sean had pointed out, and Noel too, in our work and in Men's Health Week, not this year, but the year before, we pointed out that idea that men were rising to the challenge. And I think they're continuing to rise to the challenge. And I think it shows a lot, or says a lot, about men's resilience and adaptability. And I think that's something that's been really, really important moving forward. One of the things I think is problematic for some men is that they think there's mixed messages around COVID. You know, that we got an injection, so therefore we're all good to go. You know, and I suppose as a public health message, we need to keep things simple and understandable and not, you know, looking like it's contradictory with each other. But I think that idea of the best side of men has probably been one of the most exciting things in the past year.
Very good. Okay, so let's go back to the presentations there. And Francis, can I ask you, that new Farmers Health Initiative seems to have huge potential. Can you tell us how you've been involved in that?
Yeah, we're very I suppose, want for a better word, excited about it, Fergal. Do you know what I mean? It is a new venture in a different way, and there has been a large amount of work done in this area up until this phase. My colleague, Dr. John McNamara, has been working maybe over 30 years in this particular area, but it seems to have changed gear, and we're very, very happy about that. Our own role was working directly with Conor in the development phase of the research in relation to the focus groups and identifying the important aspects of the training. And my role at the moment now is rolling out that training, and I have been at a number of the training courses with advisors. So, you know, getting down on the ground, having the conversations and discussions with advisors about this particular topic of health and
What's the
well-being.
reception been like from those advisors? I'd be interested.
Yeah, very, very, very positive, very positive, very eager to have the discussions, very interested to know, you know, are they doing, like most, if not all, are doing some of this work already, but just to know that you're going in the right direction, to have the little bit of extra kind of courage and confidence that you're doing it the right way. And then having the awareness of the supports that are available for advisors, first of all, and for farmers as well. So that's a big help for them. And even as we said earlier, you know, as Colin said earlier about, there's a lot of experience in these groups. You know, you have a group of advisors coming together. Most of the answers are there within those groups, and to have that conversation and that discussion is very, 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 very powerful. And I would like to also say that working with the HSE and the health promotion people within the trainers that are from the HSE, they're highly skilled, highly experienced. And we learn a lot as trainers alongside those in collaboration, and we'd like to see it going forward to develop and you know, be something that will continue into the future.
Yeah, it's certainly one of the most dynamic cross-sectoral partnerships that we've seen. You know, the slide that Conor had up of all the partners involved, it's very impressive. And as you say there, it fits into the building work that Teagasc have been doing. And I know John McNamara has been working on in recent years. So it's coming to the boil nicely. Noel, you've been supporting Conor's research as well. What have you learned? You know, you've been working in the area of men's health for a long time now. So, you know, what has this brought interest in learning for you?
Like Francis started with the word excitement, and I'm still very excited about the project because, as you know, Fergal, like there's health policy here and elsewhere always talks about intersectoral partnerships and cross-government department working, but we know in reality that that work can be very difficult to get off the ground and challenging to implement. So this is a real excellent example of a tangible program that represents partnership at a macro level in terms of two government departments and the HSE supporting it financially, and then at a very kind of on the ground kind of level where you've got agricultural advisors and Teagasc working with the HSE and with IT Carlow and Teagasc and so on. So it's an excellent kind of model that I think other sectors can work from. And what I've also learned is the real sort of sense of duty of care and commitment of the advisors and their kind of generosity of spirit to work in an area that they never really signed up for, you know, but they're inherently drawn to supporting the farmers that they serve. And I use their words from Conor's research. And that's how they see themselves. They see themselves as agents of support for the farmers that they serve. So I've been genuinely blown away by their commitment to this work, and it's really something that needs to be acknowledged and valued. And the last point, and it's kind of on that, we develop all our training programs using a kind of a co-design process. So essentially, we come to the train the trainer part with what we hope is a fairly final program, and then we use feedback from the trainers to refine the final program. But this program, more than any other, we had so many changes after the trainer. And while that was challenging and a pain at the time, it genuinely reflects the level of commitment and buy-in that the participants on the trainer program brought to the program. They wanted it to work. They didn't want something that wasn't fit for purpose, and they were wholeheartedly committed to it.
Okay, thanks for that. Like it is incredible that we've been able to do the T for T and some of the rollout, given all the challenges that we have this year. And I know, Sean, you've been leading the alliance on this. Where do you hope to see it going in a year or so? Like, how far can we go?
Well, I think critically, I suppose the objective was to get out to 800 advisors. That was the objective, to go and get this training done with 800 advisors across the country. And I certainly think we will probably achieve that, a reasonable number within that kind of line. We've gone and done the first batch of training, which started in early October. We had to cancel 2 of them there this week. In terms of in Killarney and Clonakilty, which is disappointing in light of COVID. But I certainly would think that we will be able to roll out the other 3 batches that we had to do in January, February, June, and July, and then October, November again, which are the kind of the down periods within advisor work across the year. So we hope to get them in. But I just want to probably reiterate what Noel was saying in terms of the partnership. And I think that's usually a care that advisors have in relation to their client groups in terms of the farmers that they engage with on a day-to-day basis. And this program was really about supporting them, supporting farmers over the farm gate, and it was critical that they had the wherewithal to be able to do that safely, and but also safely for themselves. And that's one of the kind of key things that came out of it for me. And that although a lot of the advisors were it's very important for them to support the farmer, they weren't very sure or very confident about giving that support, because they didn't feel confident themselves about what they were saying. And they weren't also minding themselves stepping into those arenas. A lot of advisors, when we talked about this program first, one of the key messages I picked up was that advisors were finding themselves quite anxious and in a poor place, because they didn't know how to respond to a farmer who may have been in distress. And I think certainly this program and the resources and material and the training that's given certainly gives the tools to advisors when they get into the room. So I think that's been really important. And the other, suppose, I think it is it's a significant collaboration, and I think it's one of the key parts of our work in the Men's Development Network is around creating partnerships and allyship. To develop allies to work a program. So so when you're developing allies, it's not nobody leading. You're kind of working together in a collaborative approach, partnership approach, non-judgmental approach, which is the same approach you do when you enter into that farmyard as an advisor. You have to be coming in to be with compassion and to be non-judgmental, to be able to offer the support that's needed at the time. So I think for me, that's really important around that allyship that's developed, and also that allyship at the kind of the government interdepartmental level. The whole thing being interwoven with Healthy Ireland, these kind of things are really, really important in a project like this. And it's not a coincidence that you see a lot of different logos at the end of the presentation that Conor presented with. But these are really vitally important people and programs who all need to be acknowledged and duly acknowledged.
Absolutely. More than this, these webinars, with the National Centre for Men's Health and the Men's Health Forum and the Men's Development Network, like it's that's an offshoot of the work we've been doing over the years, working together on these webinars, and that brings me on to Colin. It's like you're taking the allies on a different level altogether, with your Men's Health Week work. That it seems to be like you said there in your presentation that you were you were second guessing yourself in 2020 with COVID, that you couldn't encourage face-to-face events, but certainly the growth of online engagement and it's gone from strength to strength. Is that how you've seen it?
Yeah, it is certainly, Fergal. I suppose hopefully you see on the presentation, Men's Health Week has snowballed in Ireland over the years. When the very first events were happening way back in 2002, 2003, you were talking about a handful of groups putting a poster up on a shop. That's where it started. Now we've got to the point where 95 partner organizations come on board, but there's hundreds, if not thousands, of activities or events or local things that happen every year. Now, unfortunately, we sometimes don't hear about them all until after they've happened, but that's another story. But it is a kind of a really, really huge shift in how we operate. And I suppose a lot of it hinges on this idea. When I started out in men's work way back in the early 1980s, every time I went to talk about it, I had to convince people why we should be doing men's health, why it was important, why you should engage with men. And now in Ireland, I think we've moved to a different place. People have an appetite now for looking at how and what and when we should be doing. And Men's Health Week gives them the vehicle to do that. So they can tune in. It's something bigger than themselves they can join. And I suppose the things that have brought people with us or helped to get them on side is that we start with the idea that we start small and think big. So we don't try to overstretch ourselves. We say to people, come on board and do whatever's realistic for you and your place. For a men's shed, that might be having an open morning and people coming along for a cup of coffee. For a big group like the Irish Heart Foundation or Irish Cancer Society or somebody else, it might be a big campaign. But whatever you can do is realistic for you, do it. And I suppose people like the idea now, I think, of the broad themes. And I think that's important, that you can put a lot of people under the same banner. Because if in the past, as we did it, if it was only about obesity, then only organizations who saw obesity as part of their core work wanted to be part of it. But if you have something about get connected, everyone sees the point or the place in that and to want to become involved with it. And I suppose that snowball is really, really important to us. But one of the things I think is really important, and I think you see this in On Feirm Ground as well, you create a new entity or identity or badge in which a lot of people can come together and do something which is relevant to their work and have a better result than they could get on their own. And that partnership has certainly been really, really, really crucial to us. And I think where we've worked it well, I think, is that we don't have a heavy burden upon people to be partners in that. We try to take the burden away from them. And what we want from those people is their expertise and their ideas and their input and their contacts. We're not asking to put in an extra 3 hours a week or a day into the work that we do. And I think that has worked very, very well, because people along the way have did the most important thing for men's work at all, and that's to build personal relationships of trust with each other. People who actually then can say, after the meetings, we'll go off and we'll try this or do that or work together. And I think you see this in the partnership for On Feirm Ground as well. People who've been prepared to kind of put their hat into the ring, to share their expertise and experience. And we're pleased to be one of the partners in the Engage that delivers one part of that as well.
So thanks a million for that, Colin. Noel, you've been involved in the Men's Health Forum and the Men's Health Week. How have you seen it grow? Like it as Colin said, you're more likely to get involved and sustain your involvement in a partnership if you're getting a pound of flesh. You think like, this is actually helping me do my core business.
Absolutely. I mean, Colin was very comprehensive in his response there, but I mean, the couple of things that really strike me, one is the professionalism of the planning process. And I mentioned the word co-design earlier. Like, it is that partnership model where Colin convenes all the partners like almost a year in advance. So there's that kind of meticulous planning process. It's the quality of the resources, the communication strategy that goes with it, the call to action. There's a very definitive methodology and roadmap now for how Men's Health Week is run. And I think there's a great confidence in the partner organizations because of that. But I think more broadly, I think it's interesting how it's become embedded now in the calendar every year. I think it has greatly contributed to a kind of mainstreaming of men's health and creating much more awareness about what men's health is and why it's important. I think the role of men's health has been instrumental in that regard. So, I mean, I think it started with humble beginnings, as Colin said, but it's now very firmly fixed in the calendar. And the fact that we now have 90-odd partner organizations who are taking a lead in men's health back in their own organizations, that's I think the true definition of success, where
they're owning it themselves.
Exactly, and they're taking responsibility. And
yeah, it seems the partnership is the key recurrent theme today, and that collaboration, more than I mentioned the Conor slide with all the partners on it. Yeah. And you mentioned, Noel, in one of your early answers there, that Healthy Ireland aims to be cross-sectoral, but it's so much easier said than done.
That's challenging, yeah.
how is men's health, where does men's health need to go in terms of intersectoral work, or how has Healthy Ireland enabled men's health to date? Anybody want to come in on that?
Well, I'll just offer one quick thing.
Yeah.
And if Bea O'Neill was here, she'd highlight this because she's on the record of saying it for many years now. I think one of the really benchmarks of success at men's health policy level has been the collaboration between the statutory, the community voluntary and academic sectors. So Conor's project today is a good example of that, where you had Teagasc, you had the HSE, you have government departments, you've got IT Carlow, and you've got organisations like Mental Health Ireland, all signed up to do something important for a particular target group, in this case, farmers. So that collaboration between those, as I said, statutory, community, voluntary and academic sectors is hugely important in developing a strong evidence base that we can build upon.
Yeah, so we joined the dots nationally, so people can join the dots locally, if you like.
I'm a bit biased when I say this, but the value that the likes of Conor, and Conor is an exceptional student, it should be said, but the value that he brings to the table in terms of publishing this work in very reputable peer-reviewed journals, that gives the work, and I don't mean to sound big-headed, but it gives it a sense of status or clout and respectability that's really important in pushing forward. I don't think we should underestimate that.
Absolutely. Well, and a lot of the work is underpinned by the evidence that you've been backing over the years, Noel, and we've had some compliments on
I say, Fergal, as well, I think the other part in terms of that, like all of the work that's done, or to say within engaged training, which is the kind of the framework in which all of these kind of programs hangs out of, is very much around that evidence-based approach that's been there. But also, I think a lot of it's around the practice of engagement. The fundamentals behind how you engage with men and boys around the particular issues around their health. That practice of how you get into the room, how you communicate with people, how you gather people together has been fundamental, because that's about taking men where they're at. It's about understanding the positions that they're in. It's about asking them to reflect on their own position in their own places. So these are really kind of critical things that give, I think, the real opportunities for these kind of programs to be successful. And that's just not happening in the room. That also happens at that kind of the macro level about how we engage with each other. Even when we sat down as the advisory and oversight committee, it's the same kind of philosophy and vision that happens at that level as well, that transcends itself down onto the delivery on the ground. And that's really important. When we talk about partnership, it is about coming into the room and being open and honest and accepting stuff and working in a particular way. And I don't think we can underestimate that practice either. I think it's a fundamental kind of essence to what we do.
Fergal, just one quick addition. I didn't mention the word leadership in that, but the role that MDN has played in this particular project has been hugely significant in that leadership context, as being the coordinating organization for pulling all the other organizations together. So
absolutely, and I was thinking of Lorcan Brennan when you were saying that, Sean. I've been an exemplar for that authentic engagement, and as you said, in trying to develop things in the way you want things delivered. We'll do it the way we say it needs to be done, and that if we're able to cascade that example, you're more than pro-social modeling. You're really hitting the nail on the head. Okay, so how are we doing for time there? So yeah, I want to come back to the International Men's Day. I just want to ask you all before we finish up, is there any man you want to commend on a day like this in light of the Men's Development Network campaign? And Sean, maybe we'll start with you, given that you're leading that campaign.
Cheers, Fergal. I much appreciate the shout out. And I'm going to take a really easy option here. And I want to celebrate the 4 other men who are on the screen here today. And Conor, who's been here before.
We're great at backslapping each other today.
I really want to celebrate you as the caring men that I know you all to be, and how those qualities of kind of positive leadership, the abilities to listen, to empathize, and to support each other, which I've certainly felt within these rooms, but very, very supportive in terms of the delivery. And I much appreciate what Noel was saying in terms of our role on the, but I think it's certainly around that support and that willingness to be kind of to talk to each other and care for each other and mind each other as we go through these uncertain times. So I want to celebrate the 5 of you and say thank you very much, and enjoy the day, the rest of the day. Thank you.
Thanks, Sean. Francis, do you want to go next?
Yeah, so I have 2 people I'd like to mention. First of all, I'd like to mention Larkin Brennan. I've been lucky enough to have done some of the training with Larkin, and he's very encouraging and very interested. And he's one of those people that I've learned a lot from during the training exercise. So I find it very positive. And the other person is my colleague, Dr. John McNamara, who has been, I suppose, to the fore and in the background a lot of this training, and he's not here today. And I just like to think he should be. I want to mention him because he's worked very hard in this area, and he's a very good leader and very good listener. And they're the 2 people that I'd really like to mention.
Thanks, Francis. Noel?
Funny enough, I was going to mention Larkin as well, and I will mention Larkin and one other as well. But Larkin again for his integrity, the compassion he brings to the work, and there's a great expression about when he gets a group together in the room that he says you're in your grannies, and it just settles people. So he's got the most incredible talent to create safety in a room that I've never seen reproduced anywhere else. And he's also been a very dear friend of mine for a number of years. So I just want to acknowledge that. And also another man who may be listening today, I'm not sure, is John Costello from Kerry, who's been a very dear friend, and I just want to acknowledge his support over the last number of years.
That's lovely, Noel. Thanks. And Colin?
For myself, I must admit, I just find it very hard to find 1 or 2 men that I would like to come in on a day like this and to celebrate, because that's what International Men's Day about. So I'm actually going to opt out slightly and go for the unsung heroes. And the unsung heroes for me is kind of all of those men around the whole of the country who, without any financial reward or any recognition or any kind of sort of public accolade, just do their best to get on as fathers and as partners and as carers for family members, and particularly as volunteers as well, and other organisations, particularly driving on men's work at the grassroots level. And we couldn't name all those people. There's tens of thousands of them, and I think that's a great sign for the future that we're all pointing in the right direction.
Yeah, well, I'd like to give a shout out to all my male colleagues in the health service and in the front lines, I suppose, in a general sense, that it continues to be an extremely challenging time on the front line. And there's various degrees of front line. I was thinking this morning of my brother. He works as a chef in Castlebar Hospital, and it's like he's been on the front line of the front line. He's serving but he's not patient facing. But obviously every little hiccup in the hospital impacts on the work there. And I'd like in particular to actually give a shout out to my colleague, Eamon Keogh, who's, we've been working very closely. We have a small team, himself and Finian and Noreen and Susan and Jolene, but Eamon and I have been working very closely on a number of projects, and just he's helped me a lot. So I'd just like to commend him today as well. And thanks in particular to Finian in the background. I know Finian is answering questions on the Q&A, and he already gave a presentation this morning to the group. So I appreciate your work and support, Finian, as well. So look, lads, we might round up the panel there, and I just have a few notes to share with everybody on other things that we're doing at HSE Health and Wellbeing. So I'd just like to really thank you guys for coming on and for your participation and input today. So for let's say goodbye to the panel, and I just have a 1 or 2 announcements that I want to share with you. My colleague Anya Ling in the National Cancer Control Programme is working with the Heads Up Kildare, and they're teaming up to do a webinar next week focused on men's cancers, what to look for, what to do, and what next. And my colleague Finian, the aforementioned Finian in the background, is actually presenting on that. And we've shared a note about that in the chat, and we'll send the link again in the follow-up webinar. Away from men's health then, and there's a few other things coming up that we can share some of these resources from our other areas in HSE Health and Wellbeing. Monday the 29th, we are kind of co-sponsoring a virtual conference, Environment, Health and Wellbeing, with the EPA and the ESRI. So we will, our colleagues, Dr. Stephanie O'Keefe and Dr. Philip Crowley, will both be speaking at that event, and we can share the free registration details on that in the follow-up email as well. We have an event around tobacco-free campus next week. So if you're interested in developing tobacco-free policies in your workplace, you'll be very interested in this event. Our tobacco program is leading on this, and we'll be giving some insights into some of the HSE sites and the work that they've done around tobacco-free campus. And again, we'll share the registration details with you. We also have a safe food webinar for parents coming up, or it's actually in partnership with Safe Food. It's based on our Start Healthy Eating campaign, and it's targeting parents. So we can share those details with you. And I mentioned at the outset the different webinars and the different speakers that we have had on. So we'll put them in a playlist on our YouTube channel. We'll send you the link. So anybody, and we'll put in more details into the description. So if there's any particular speaker you want to go back to, we'll give you the time slot and the date, so that if you want to go back to, in particular, to hear somebody or something speak on a particular topic or population group or initiative, it should be easy for you to find. So look, that's about all the announcements I have, and I appreciate your time. And as I said, we'll try and get you away for lunch. So that's all from me. Wish you all a happy Christmas and a happy New Year, and hopefully we'll be back in the new year with some more men's health news and engagement opportunities. But I'd like to thank you all in particular for taking the time today to tune in. Bye-bye.